Well, welcome back across Nevada to Ralston Reports. Where is Michael Roberson? I talked to the guy all last session, and he wouldn't come on this program to debate his primary opponent, Carl Bunce. He's coming up. And Becky Harris, who he's anointed for the most important race in this state, for State Senate District 9, and could determine control of the state Senate. Becky Harris is a ghost. We don't know where she is. Her opponent, Gill, has decided, though, to come on this program because he likes me so much. All right, health care. You keep talking about this Patient Bill of Rights. It's the first bill you're going to introduce. What will it do?
Well, John, other states have implemented a Patient's Bill of Rights. It fundamentally would take patients from the back seat, put them in the front seat, and from the front seat to the driver's seat, allowing them to make decisions, giving them the information necessary to make those decisions. For example, patients that are on Medicare, a Medicare patient may go to a health care provider. It's important for that provider to tell them exactly what the rate would be for their Medicare reimbursement, so they're not hit with an unintended consequence of seeing that physician in a bill that they didn't predict. I believe fundamentally it will protect Nevadans from any of the adverse effects of Obamacare, but fundamentally give them more information, give them more transparency in regards to their health insurance and the medical care that they're receiving.
Well, let me show you what you said in an online interview with Nancy Dallas. She did a bunch of online interviews with folks about your position on health care. I oppose Obamacare and would like to see its mandates repealed. I propose a return to patient-centered health care where patients choose their health plans and within those plans choose their doctors. My first piece of legislation will be introduced, as you said, the Patient's Bill of Rights to protect patients, put them back in control of their own health care decisions. Unfortunately, sir, we live on the planet Earth. Obamacare is a federal law, as you're well aware. You can't do anything about Obamacare.
John, there's things that we can do here in the state of Nevada. As you know very well, 25,000 people last year lost their insurance as individuals due to Obamacare. Recent articles expect that number for small businesses, people working with small businesses, to increase to 90,000.
Did you see how many people signed up? Did you see what's going on? 150,000 in the expansion of Medicaid. Would you have opposed that?
Well, I'll say the other way. You know what? We were expected to have 120,000 people in the state-run exchange that only signed up 25,000.
That's a disaster.
It is.
So would you have voted against the state-run exchange if you were in the legislature?
Well, John, as you know, Obamacare was held constitutional by the Supreme Court, and the governor had two decisions. He could have made a decision to run a federally run exchange or a state-run exchange. I believe it was the correct decision to run a state-run exchange. It's better for Nevadans to control their health insurance exchange. But I believe the legislature should not just rubber stamp a president's policy. It is incumbent on them to have oversight on this issue, to predict that maybe Xerox, the company that was hired, we paid millions of dollars to Xerox, to understand the difficulties that may have come down the road, to have different positions taken, different steps taken to make sure that this wasn't an abject failure.
You don't blame the governor for that?
I blame legislatures. Legislature is there for oversight. It is the governor made a decision to have a state-run exchange. I believe he made the right decision, but it's legislatures, like our current state senator, Justin Jones, who's the chairman of the Health and Human Services Committee, to understand that this is a big issue for Nevadans. Let's make sure it works and not to waste taxpayer dollars on a fundamental failure of a health insurance exchange.
You're blowing right through the primary. You figure the primary's done. You're going right after Justin Jones. That's really interesting. What about expanding Medicaid? You're a doctor. Was the governor right to expand Medicaid?
Well, John, expansion of Medicaid, the people, your viewers, many around the state should understand this. Expansion of Medicaid will affect 138% of the federal poverty level. For one individual, that's about $15,000, somebody making $15,000. Family of four, maybe $33,000, $34,000. It is important to give the opportunity for individuals to have insurance. I understand that. But what about the middle class? The people I meet every day, those that make more than $15,000, family of four making more than 30, they've seen double and triple increases in their health care costs with reduced benefits. It's important to think about them. And it's also important to understand that the Medicaid expansion will cost $1 billion over the biennium. So it's important that now the federal government...
You know we're not paying for that. We're not paying for that.
But John, let me ask you a question. When the legislature meets in 2 years, we will have to pay for it. As that federal subsidy comes down, it is going to be on the backs of taxpayers.
So you would have voted against the expansion of Medicaid?
I think it would be important if we're going to expand Medicaid. It is important to fundamentally change. You read a quote from me in an online interview that we change the way we deliver health care to a patient-centered model. That's why implementing a medical school at UNLV is important.
I think you're right about that. It'd be great if we got a medical school. But you haven't answered my question. If you were in the legislature in 2013, would you have voted to expand Medicaid?
I would not have voted to expand it the way it was done. I would have fundamentally asked for other reforms. That included a medical school, which is now being talked about, wasn't talked about then. Fundamentally changing the way that we look at health healthcare here in Nevada. Standing up for the middle class, John. The middle class is the one that they're people in my district.
People who are uninsured. You don't have a plan for uninsured. You don't like Obamacare. How are you going to take care of the uninsured?
Well, the insurance is regulated here at the state level. I support more competition within the insurance industry. I support more physicians. That will give patients more choice, better quality health care. I do believe that people should have the opportunity to have health care. I support people that have a job, supporting employers to provide that health insurance coverage to them.
All right, Vic Gill, I really do appreciate your willingness to come on this program. I'm sorry that Becky Harris didn't come on with you. I wish you the best of luck on June 10th. Thanks for coming on.
Thank you, John.
When we come back, we'll talk to Michael Roberson's opponent, Carl Bunce. Maybe Michael Roberson will mysteriously appear during the break. I'm hoping.